on for a minute, and we're going to announce where all the different breakout sessions are going to be. The last discussion for the day is going to be on the important issue of caregiving and the role of family in caregiving. Dr. Siegel is the Dean of Department of Psychology at Yeshiva University, and he has a specialization in behavioral medicine. And I love him like a brother because he is my brother. Larry.
I will do my best to whiz through this so we can get on. I think we're supposed to be ending now, so we'll do the best we can here. Basically, what I'm going to talk about today is a very fast overview of some important issues about families who have a member or members who have chronic medical conditions such as TM and related disorders and or related disabilities. First of all, we know that there are many daily stresses in life for all of us who don't have disabilities, but when you add that to having to care for a spouse, child, sibling, or parent with a chronic medical condition or disability, the stress of being a caregiver can be quite overwhelming. We know that there are an estimated 25 million caregivers in the United States today, and some of these individuals require around-the-clock supervision and at minimum certainly help with some daily activities of living. Caregivers can experience considerable stress from their added responsibilities for caring for a loved one. They can experience, as a result of that, depression, anxiety, or physical ailments as a result of their caregiving tasks. Caring for someone with a chronic medical condition can be time-consuming, and it often requires the caregiver to forego many of their own activities, such as work, time with family and friends, and time for their own leisure activities. The challenges of coping with a chronic medical condition impacts the patient's entire family in one way or the other. The stresses on the family may be greater, in fact, sometimes than the stresses of the patient who has the chronic medical condition. We also know that all families have role expectations, and that these role expectations are often affected by the diagnosis of a chronic medical condition. And changes in these role expectations within the family as a result of the chronic medical condition can contribute to stresses within the family. And just some quick examples, you know, adolescents who are striving for independence as it is as part of their developmental tasks, and then developing a condition such as TM or related disorders may then become dependent or more dependent on other family members, or spouses who are used to participating in activities together may not be able to do so when one of the family members develops a chronic medical condition. To put this this whole talk in a nutshell, and I know this is easier said than done, but it's important to, I think, get this point across, and that is coping with a chronic illness such as TM necessitates really putting the illness in its place. And this means that the family needs to attend to the demands placed on them by the illness and not allow the illness to dominate the family's schedule or control the family's medical life. Families need to try as best as possible to maintain day-to-day routines, family rituals, holidays, traditions, and to attempt to attend to all the needs of all of its family members. Okay, so now that we're talking about stress, just some things to think about in terms of ways to reduce that stress that we can use in our everyday lives, particularly from the caregiver's perspective. First of all, don't take on more responsibility than you can handle, and learn to say no or to get someone else to help. Use relaxation techniques such as meditation, visualizing scenes, pleasant scenes, listening to music. There's lots of tapes out there that one can listen to use to help one to engage in these activities. Take one thing at a time. If you have an overwhelming amount of things to do, try to prioritize and pick one task to work on at a time, and when you accomplish that task, move on to the next one. Make your lifestyle as healthy as possible by watching what you eat, limiting caffeine and alcohol, not smoking, getting rest, exercising, and balancing recreational activities. I think people underestimate the value of exercise. Makes you feel better, keeps your weight down, and really is a great stress reliever. Schedule time to take a break and do things that you enjoy. Have friends you can turn to for love, support, and guidance. That is, the most important thing is develop a network of supports for yourself. Educate yourself about your loved one's condition. Information can be a very empowering thing for an individual. Consider joining support groups. There's lots of support groups out there for caregivers and related individuals. If the stress becomes too overwhelming, you can see your physician or other health-related professionals to help you identify resources within your community. Burnout. We all experience that in our lives sometimes in one way or the other, in our work situation, whatever, and caregivers, as part of their tasks and responsibilities, can develop burnout. And when you're experiencing those things, it's usually a pretty good signal that you need to take better care of yourself and or possibly seek professional help. And these are some of the, I won't go through them, but some of the basic symptoms or signs of having burnout. And if you're experiencing these on a chronic basis, we all get these at some point or other, but if you're getting these on a chronic basis and lasting for several weeks at a time, it's probably a good signal to get some professional help. Stresses faced by families with a member who has TM or related conditions. Just some examples. Sometimes getting too much information and being overwhelmed, or not enough and wanting to know what's going on. Having to make a lot of decisions, particularly in the early phases of the disease process. Having to deal with new terminology, fear of the unknown, emotional distress, anxiety, depression, or guilt. Altered expectations of family members and the patient themselves based on their medical condition, loss of quote, normalcy in one's life, feelings of lack of control, lack of independence, experiencing pain and discomfort, performing home care activities on a frequent basis, having to deal potentially with invasive procedures, disrupted sleep patterns, changes in self-image or identity, job and financial worries, families having to reorganize their role functions, having lack of supports in your life, potentially strain in marital relationships, the needs of siblings, which we'll talk about in a little bit, strained or lost relationships, unpredictability of events, isolation from family or friends, disruption of routines, other extended family members, such as in-laws, grandparents, etc., having difficulty dealing with things, and work or school disruptions. What are some useful tips for families in terms of coping with some of these things? First of all, being aware of each other's strengths and weaknesses and being respectful of each other's coping styles. People have different ways of learning how to deal with stress, and it's important to respect those. Delegate, share, and take turns. Use the buddy system to fill in when one member is overtaxed. Take breaks. Family members each have to have their own needs and should participate in unrelated activities to the disease. All family members need ego and energy boosters so they can come back refreshed and ready to tackle the next situations that they have to deal with. Keep everybody informed of what's going on and periodically reassess your goals and expectations for each other, because they may change over time as the medical condition may change. Okay, just very briefly, I want to just talk a little bit about some of the different role functions in families, and how different people, depending on their roles, need to think about how they deal with stresses in their life, and to think about how to be a caregiver. We know there are gender differences in terms of how males and females relate in our society, so we're going to talk a little bit about that. First of all, for mothers and or spouses, don't try to be super mom. Ask for and accept help. Don't be daunted. You can learn new skills you need. You can stretch and grow, and your child and or spouse will benefit, and you'll become stronger as a result of that. You need to stop beating yourself up about what you should have done and what you should be doing better, and matters that are out of your control. Take breaks, take walks, do things for yourself, basically. Take a breather. Don't wait for anger and resentment to boil over. If something's bothering you, you should talk about it and say something. Share your feelings with family members and listen to their feelings also. Fathers, in particular, be a full participant in the caretaking and treatment process. Share your feelings with family members and listen to their feelings. Express the impact on your sense of self, your ability to continue work and provide for the family, and your visions of the future. Be willing to ask for help and accept it. Explore what you have learned from the experience, and how your family and how your role in the family has changed, either for the better or for worse. Share your thoughts, feelings, and fears and hopes with others. For spouses, together with family members, figure out which coping styles and behaviors meet each other's needs and which don't. Communicate both ways, that is, listen as well as talk. And there are going to be times when there are disagreements, and it's important to learn how to fight fair with each other. Compromise must be a two-way street. Meet each other halfway. Take turns and share duties and responsibilities. Support your partner's style of coping, even though it's different from your own. Go together to important medical events and consultations. It provides strengths and solidarity for yourself and your child or spouse. Support rather than undermine each other's relations with children, family, and medical personnel. And finally, allow each other some separate space. Spouses need to retain some separate identities, despite what may be some dependence, which is necessitated by the chronic condition, particularly when caring for another spouse. Okay, some quick words for single parents. Cultivate partnerships with trusted friends and family, a competent child care provider, home care or visiting nurses, teachers, school nurses, volunteers, others in the community. Educate your helpers about your child's illness, and there's many ways to do that. Workout guidelines. Let's see. Workout guidelines with staff to keep you in the loop when you're not there. Insist that procedures or exams be done, that not be done without you or your representative, particularly if the child or the individual is in the hospital. Swallow your pride and be willing to accept help, and don't try to be a super parent. Join support groups, talk to a therapist, or unload on a friend. Give your time only to those things that absolutely require it and are worthy of you. Take time for yourself to recharge. And if you have a relationship with a non-custodial parent, do everything possible to try to enlist the help of that person and put things behind, and if necessary, even get counseling or a mediator, so you're not having to do things on your own. And then, finally, there's issues of siblings. And I'm particularly now talking about dealing with sibling issues where you have a child, your child has the chronic medical condition, which oftentimes necessitates that you're going to be paying a lot of time and extra attention to the child who has the special needs, and what happens to the brothers and sisters. and what are some of the issues to think about. First of all, the well siblings sometimes worry about the ill siblings' health and ability to cope, and that creates stress for them. Younger children sometimes have anxieties or fears that they could catch their sibling's condition. It's important to explain that to them that this is not the case and address that. Sometimes younger children have fantasies that maybe they did something bad to cause the illness, and the punishment is that their sibling got ill. Siblings will sometimes feel very guilty when they have what we all have as kids, which is normal sibling rivalry, and when they have that, they feel extra guilty about it, and sometimes it's necessary to talk to them about that. They sometimes feel isolated from the family, particularly at times when there's medical crises, isolation from peers, fewer social outings that they might not get as a result of parents having to spend more time with the ill child, lack of attention, feeling abandoned, resentment and jealousy, and sometimes even acute and chronic stresses that may even relate to what we now call post-traumatic stress disorder. There's also the issue that the sick child gets preferential treatment, and sometimes parents behave differently toward the ill child by sometimes laying off a little bit on the discipline, whereas they don't do that for the well child, and there's perceptions of issues about that. Increased responsibilities and chores that sometimes the well children have. Anger at parents and the sick child, which creates a lot of guilt feelings in the siblings. Ambivalent feelings toward the siblings and parents. There's a lot of unpredictability for them about what's going to go on. Sometimes they have embarrassment or shame about this, and they'll stop bringing friends home because they don't know what to do with that in terms of their sibling who has the medical condition. Depression, guilt at negative emotions, loss of a normal childhood, disruption of routines, and confusion or lack of information or misinformation. And again, the most important thing that I think I can say is communication, communication, communication. It's really important that people feel comfortable in talking to each other, and if there are questions or you're sensing something either from a spouse or a child or whatever, it's important to talk about it and at least check things out. Avoidance is not necessarily a good thing in this situation. And finally, what I want to do is just very briefly read to you what are considered to be important things to think about from the perspective of caregivers in terms of taking care of yourself. I have the right to make mistakes and be imperfect. I have the right to forgive myself and begin anew. I have the right to say no and not feel guilty or selfish. I have the right to take a break and relax. I have the right to let go of yesterday and embrace today. I have the right to enlist the cooperation of my family. I have the right to laugh and be happy. I have the right to arrange my own priorities. I have the right to take care of myself. I have the right to have my needs considered important to others. I have the right to do special things for myself. I have the right to take time off, even if it costs money. And I have the right to be self-preserving so that I can care for others. Okay, thank you.